1 out of 5 women in India suffer from polycystic ovary syndrome. PCOS affects millions of women of reproductive age in India and is a leading cause of infertility. Hi, I'm Sania Mirza, and I take privilege to welcome Dr. Shweta, a renowned health expert who will offer practical strategies to empower women in managing PCOS complications. Raising awareness about PCOS can greatly benefit women due to the numerous myths and misconceptions surrounding the condition. Doctor, can you enlighten us on how a balanced portion control meal can positively impact a PCOS patient?
Thank you, Sania. Obesity is a common finding in women with PCOS. Around 40 to 80% of the women suffering from PCOS are either overweight or are obese. So dietary modification is considered to be the cornerstone in management of PCOS throughout the world. Dietary intervention in women with PCOS should be focused on energy restriction, which encourages the weight loss. Firstly, calorie requirement is calculated considering the person's body mass index and the physical activity. Then diet is planned taking appropriate nutritional constituents in correct percentage. And the balanced portion control means managing the amount and composition of food a person eats during a meal. To effect this, we use two methods. First is use of portion control plates. So these plates feature different sections for each food item like the vegetables, proteins, carbohydrates. Thus, it encourages the intake of balanced meal and also restricts the amount of high glycemic index foods and encourages taking the complex carbohydrates more. Second method is maintaining a food diary. So this allows in monitoring and identifies the trigger points and the areas of control where we can do more modification. Thank you.
Thanks, doctor. Can you also share how crucial is physical activity in the management of PCOS?
Very relevant question, Sania. So the most effective and preferred method of treatment of PCOS is lifelong lifestyle modification. Several studies have studied the impact of physical exercise on the symptoms of PCOS, and they have found that this is positive impact on the hormonal and metabolic parameters of PCOS by exercising. A weight loss of around 5 to 10% is effective in achieving regular menstrual cycles, improving fertility, reducing the insulin levels, and also reducing the testosterone levels, and hence stopping the progression of hirsutism and acne. So the basic fundamental of exercise helping in PCOS is in reduction of the insulin resistance. So PCOS guidelines suggest that at least 150 minutes per week of moderate intensity physical exercise should be undertaken to have most of the effects. And we can encourage the patients for goal setting, monitoring and reviewing. We can suggest them the use of smart watches to measure their count, step count and heart rate while exercising. Exercise also has the benefit of improving mood and reducing stress as it releases the hormones like dopamine, endorphins and serotonin.
Thanks, doctor. One more question. What are the important parameters to be regularly monitored in PCOS patients?
So constant monitoring is very important and it helps to prevent the development of cardiovascular disease, uterine cancer and GDM. So patients with PCOS should be encouraged to have regular monitoring of their weight. They should aim to keep it in their normal body mass index, their waist circumference. For women, it should be less than 35. Then their menstrual cycles, they should keep a track. They can be encouraged to download an app to help them do it. Then they should be doing the blood pressure measurement, and the oral glucose tolerance test should be done at the diagnosis and also during pregnancy, as there is higher risk for them to develop GDM. Then they should also be screened for depression and anxiety. They should be watched for cardiovascular risk factors, including the lipid profile, at the diagnosis and on ongoing basis to prevent cardiovascular risks. So The constant monitoring is very important for all PCOS patients. Thank you, Sania.
Doctor, the clear message for all women is that meal, movement and monitoring are pivotal in managing PCOS for the benefit of women and society at large. Thank you, Dr. Shweta, for your valuable insights which can be vital for effective management of PCOS. As an athlete myself, I recognize the importance of lifestyle management for a healthier tomorrow. Together, we can break the stigma, spread awareness, and support each other in this journey towards better health and well-being.